Hi, my name is Dr. David Marshall. I'm the Medical Director for the Sports Medicine Program at Children's Healthcare of Atlanta. And today we're going to talk about the importance of recognizing common injuries seen in the young athletes. Unfortunately, injuries are a common and expected part of playing sports, but learning how to recognize and initiate proper treatment of an injury early might lessen the progression of the injury and effectively have a more timely recovery and get you back on the playing field quickly but as safely as possible. There are two main categories of injuries. There's the macrotraumatic injuries. These are the fractures, the dislocations, the sprains, the strains, the concussions. This is basically when an external force is applied to a tissue, the tissue can't handle it, and then the tissue breaks or tears. Unfortunately, these are accidental. We can't prevent these. The second type of an injury is an overuse injury. These are the microtraumatic injuries. These are when chronic repetitive stress is applied to a tissue, and then over time, the tissue fails. These include tendonitis, stress fractures, and then injuries to the growth plates. Now, growth plates are common in kids in that they have growth plates all over their body. There's really two types of a growth plate. One growth plate is an actual growth plate. That's a band of cartilage found at the ends of the long bones, and that's where bone is manufactured. Therefore, our bones grow during deposition of bone at the ends of all the long bones. There's another type of a growth plate that really shouldn't really be called a growth plate because its job is to serve as an anchor point for muscles and tendons. Common factors to be thought about with overuse type injuries are number one, training errors. Training errors are what the athlete does to themselves. This might include the number of pitches, the number of games they pitch, the number of miles they run, the hours that they run, or adding extra training regimens such as speed and agility training, running stadiums, hills, bleachers, spending extra time in the weight room. Over time, if your body can't adapt to the stresses placed on it during the workout, well, then overuse may develop. One anatomical part that's unique to young athletes, including teenagers, is the growth plates. Growth plates are areas in the body where there's still cartilage. It has not returned to bone yet. Growth occurs at growth plates, and also growth plates serve as anchor points for muscles and tendons. If the athlete practices too much, if they don't take adequate rest between training sessions, then these growth plates can get irritated and result in injury. One thing to think about when training is training errors. These are things that the athlete takes to the training room or takes to the field or the venue. What that is, it's too many pitches, it's volume of games, it's too many sets in the weight room. It might be special training programs like speed and agility training programs. It might be running stadiums, hills, bleachers. All these exercise regimens that are designed to build up strength could also result in developing an overuse injury at the growth plate. Another thing to consider is an anatomical factor, such as having flat feet, having tight hamstrings, if you have poor core strength or core instability, or if you have weak rotator cuff muscles. If these things aren't rehabilitated and you take on an exercise program or a training program, this might increase the risk of an overuse injury as well. Another thing to consider is biomechanical factors. This is basically your technique. Whether you're a thrower, a runner, or a swimmer, technique is very important. So if you have poor technique or you develop some bad habits in your technique, then this also could predispose you to overuse type injuries. Common overuse injury sites depend on the sport that you're playing. For example, collision sports like football, basketball, soccer, lacrosse, the knees, the hips, the ankles, the shoulders are very common sites. Other sports such as baseball and softball, it's going to be the upper extremities such as the shoulders and the elbows and even the wrist, for example, in gymnastics, can be affected by overuse. Tumbling sports like cheerleading, gymnastics include low back, knees, hips, ankles, and as I stated, wrist injuries. Signs and symptoms of an overuse injury include pain with activity, the joint may become swollen, you might have decreased performance, or you might notice limited joint range of motion. Treatment of overuse injury basically is to underuse it. The opposite of over is under, so to treat an overuse injury, you have to underuse it. This basically means playing one sport at a time, playing two sports at the same time, or playing on two separate teams at the same time definitely increases your risk of an overuse type injury. You need to limit your yardage, your mileage, the number of pitches or the number of throws if you're an overhead thrower such as a baseball player. If you're in the weight room and have an overuse injury, you need to decrease the weight, decrease the reps, maybe only work out that same body part once a week or twice a week rather than 3 or 4 times a week. If you're training outside, avoid inclines. It's much more stressful to run uphill, such as stadiums, hills, and bleachers, than it is if you keep your training on level ground. And then look closely at your conditioning program. Oftentimes just modifying the workout load, modifying the hours, modifying consecutive days, that might be enough to put the initial treatment plan on an overuse injury. A good overview of the treatment principles of treating overuse injury is just think of the mnemonic PRICEM, P-R-I-C-E-M-M. The P stands for protection. Basically, if you injure something, you need to protect it from re-injury. That translates into holding out from the sport or modifying the workout to avoid re-injury. The R is rest. You have to rest. Really, rest is one of the most important treatment regimens that an athlete that's injured can take on. Don't feel that rest is neglect. Rest is actually a very effective treatment pattern. I is ice. Anytime an area is injured or it hurts, we have to assume there is an inflammatory process, and a very cheap and effective anti-inflammatory treatment is icing. A nice way to ice is do what we call ice cup massage. Get a styrofoam coffee cup or hot chocolate cup and fill it up to the top with water and freeze it. And then you can take that cup out of the freezer, peel back 1 inch of the paper around the bottom of the cup, and that leaves you with a frozen snow cone or a push-up pop, and directly apply the ice to the area in a circular compressive fashion for 10 to 15 minutes. I believe this is a little more effective than just putting an ice pack on the sore area. Compression. Anytime a body part is swollen, such as the ankle, the knee, the elbow, or the wrist, it needs to be compressed. Compression with an ACE bandage or a compressive wrap will help decrease the swelling and limit the progression of the injury. Elevation. Again, anytime a body part is swollen, we need to elevate it to help get that fluid out of there. Fluid is going to go where gravity takes it. So if the extremity is elevated above the level of the heart, it's a lot easier for that fluid to leave the body part and promote healing. The first M is medications. There's a lot of different medications out there. Anti-inflammatory medications are useful. They have an anti-inflammatory as well as an anti-pain property. Talk to your doctor about the proper dosage and regimen of those, realizing they can be very helpful in treating an overuse injury. And the last one is modalities. This is basically physical therapy. Some injuries, if they seem to be ongoing, may benefit from treatment from a physical therapist who can provide ultrasound, electric stimulation, other modalities to help limit inflammation and get the athlete back on the field as quickly but as safely as possible. A question often asked of an athlete when they come in with an injury is, when can I return to play? And they want me to tell them a date. They think it's a time-oriented report. We see on TV a lot an athlete might be sidelined for X number of weeks, but in reality, that athlete will not return to play until the medical and the training staff say the athlete's injury is recovered and they're ready to play. First thing you must acquire is you have to have full range of motion. You can't go back out there and play if you have limited range of motion in your shoulder, your elbow, your wrist, your knee, or any other body part. You also have to have normal strength. Again, you can't protect yourself back on the playing field if you don't have normal strength of that injured body part. And then the third thing is, like we just said, you have to be able to protect yourself. If you have trouble doing a push-up or can't bear body weight or can't run or push off, it's very difficult to get clearance to go back and play because you just increase the risk of re-injuring it, and the re-injury might be worse than the original injury.